Thanks everyone for joining us this evening for our Enhanced Care MD Soho and Small Business webinar. My name is Tina Manfredi. I'm one of the product marketing managers here at 5 Links, and I'm here today with our Enhanced Care MD partners to give you a detailed training into the newest commercial product release, 5 Links Enhanced Care MD Commercial. So now I'm going to pass this over to Jerry to get us started.
Thank you, Tina. Let me frame the small and Soho business levels for you before we turn into the webinar. Small and home-based companies will have some real important choices to make regarding health care for their employees as it relates to complying with the Affordable Care Act. There are over 60 million people, that's 60 million people working in companies that the government considers small. First of all, any company that has less than 50 employees will not pay any fines or taxes because they don't insure their employees. So that gives the employer owner a lot of choices. To facilitate small companies in actually insuring their employees, though, what the government is going to do is going to provide some incentives to the owners. Depending on qualification rules, there are going to be tax credits up to 100% of the payments of the health insurance employers will be able to access by giving the right level of insurance to the right people. In broad terms, they got to pay at least 50% of the costs, and they have to have the right demographics with employees. On irs.gov, there's a lot of that information if your owner prospect starts to ask those questions. And tax credits go right to the bottom line. So there's nothing an owner likes better than a credit on something they already spent and they get back in full. So what a small business employer owner needs to make a decision on is, what does he do with his employees now? He can send them to a private exchange. There's actually a government exchange called SHOP, S-H-O-P, or they can insure them like they always have with their regular insurers like Excellus, Blue Cross Blue Shield. Enhanced Care fits in any one of those programs because every one of them are high deductible, high out-of-pocket costs. So what does Enhanced Care do? It allows your employees to learn more about their own care, how to manage the costs, and keep their deductibles down. So it's a real win-win. So anything a small company owner is thinking about, we're going to play a big part. So let's go through the specifics, and here's Dave Coffey to take you through that.
Thank you, Jerry. So everybody, I'm just going to quickly go over what we're going to be covering in this presentation for the home-based and small business commercial solution for Enhanced Care MD. And we're going to talk about what it is, why this is important for commercial businesses, especially the target market that we're talking today, which is the single operator home-based small businesses, what other additional benefits, who can benefit from it, and we're going to talk about the pricing and compensation for 5 Links representatives. So let's just see, what is 5 Links Enhanced Care MD Commercial? So it's the same great benefits that you've been enjoying for the last few months with Enhanced Care MD, but now it's available not just for residential, but now it's available commercially. So now you can target businesses and be able to benefit from that. And really, the big benefit of the 5 Links Enhanced Care MD commercial solution is that for you as a 5 Links rep, it is huge. Now you can leverage multiple customer points and greater commissions when you make one sale. So think about that. When you can sell to 10 people, you get 10 customer points each month that the sale goes through. So it's a huge benefit for you. Tonight's presentation is just going to be focused on the single operator home-based businesses and small companies. And so let's just give a quick review of what that means. We're talking home-based businesses, mom and pop shops, things that you probably frequent every day with your own business. And maybe you know a lot of those people within your community, your friends, and so on. So what a great way to start there and get comfortable in giving them this option. But you could also move and look for small businesses like restaurants, hair salons, other small stores that have between 11 and 100 employees. Now, that is also a great target for people to start looking at Enhanced Care MD for them. So I'm now going to turn it back to Jerry so Jerry can share about the business values.
Thank you, Dave. When you're talking to an owner of a small company, they have 3 things on their mind as to what's important in making a decision here. And the first one is always cost. What is it going to cost me? Everything is always thinking about the out-of-pocket element of it. So if they are providing insurance now, and they're not providing high deductible health plans, you need to make that a requirement of what they're doing. You need to push them to do high deductible health insurance for every employee and add Enhanced Care MD in as part of that plan. That's a very key. They're going to save 25% or more on their premiums, which is a win-win for both them and their employees. Now, if they already have high deductible health insurance, then you start to talk about how do you make it most effective so it's actually helping the employees be good at managing their own care, because that's what it's all about. It's driving the accountability back to them to manage their care, understand their costs, and to have options. And that's what Enhanced Care MD does. So in that cost element, you have a good story to tell. Small companies also worry about how their employees are feeling. They need the most productivity from them because they have very few employees, so it's very important. So this is a win-win. If they can give Enhanced Care MD to their employees are going to have some extreme goodwill back for the employer, because they can get a better chance to spend less on their own care and have better outcomes for their family. And of course, the bottom line is always important. This is different than cost in a few ways, because the bottom line is actually their profit level and what they take home. The tax credits and the ability to use pre-tax dollars for Enhanced Care MD are big profit makers for them. So just look at it as a quick example. If you had 10 employees and you were going to spend $6,000 per employee, they're spending $60,000 on health insurance. Well, they can get that entire $60,000 back with a tax credit if they comply with the regulations. That's a big thing. So, all three of those are key ingredients to a decision and things you should know about. Now, a couple of pages on the company benefits. The first 2 points here, we've talked a little bit about. The tax credit's very important. Wanted to reiterate that that's 50 employees or less is where that tax credit kicks in. And decisions around whether to move them to a public exchange, private exchange, or give insurance are up to the owner, but he's got to do one of those three things. And in doing so, he doesn't get penalized by the government, but he gets some incentives. And each case, you can give him Enhanced Care MD as a benefit for the employees. But the 2 points in the bottom there are new, and I want to spend some time on them. Attracting and retaining employees with greater benefits. Anytime a company, particularly a small one, that can offer something that another small company is not offering, they're going to get better employees coming to the door. And better employees mean more profits, more productivity. And another point about small companies is they usually don't have enough people to do more administrative tasks. They're worried about the customer and what's going on with their product. The good thing about Enhanced Care MD, and you'll see this later when Dave goes over the whole self-enrollment process here, is we do everything for them. So basically, we're going to self-enroll all their employees. We're going to do awareness campaigns, and we're going to communicate to their employees, and we're going to drive utilization for them. There are also some intangible benefits that really are important to small companies. The first is we reduce time away from work. Every hour a person is on the job when you only have 10 employees is a critical thing. So when you start to tell them that 44% of our users save time away from work up to 6.9 hours each time, that's a big productivity boost. That's an intangible because it's hard to measure, but it's there. Same thing if we have an employee that's sick on the job and they can actually call telemedicine, call our nurse from their desk and get resolved. That actually keeps them at work and keeps them productive. And 96% of our users claim they have higher productivity post using us than before. Those are key numbers. And we talked about the communications, a key in terms of driving our efforts to help the employer communicate to his employees. Now I'm going to turn it over to Angie to just reaffirm all the benefits in terms of the services for the employees.
Thank you, Jerry. So I'm going to talk a little more about the 5 Links Enhanced Care MD program for companies. It's actually the same great services that we as individuals have enjoyed in the residential program. Now we're offering it to companies for their employees. It's an affordable health care solution. Helps to reduce the cost of health care. It's quality health care, saving you both time and money. This program is going to deliver the lowest cost health services for you. You now have choices, and your choices can be less expensive, not to mention greater convenience on your time. 24/7 access, whether you're at work, whether you're at home, it's in the middle of the night, or traveling in the field, you've got access all the time. So every time you use this program, you're going to reduce your health care costs. On average, we're seeing our members saving between $1,000 and $1,600 per year by using the Enhanced Care MD services. Employees become more engaged in their care because they now have more choices. They now can pick up a phone and talk to a nurse, or pick up a phone and have a consultation with a doctor versus going to see their doctor or going to an urgent care clinic. So employees have more control over those expenses with this program. Let's talk about the benefits of the Enhanced Care MD program. Number one, you have got access 24/7 to our registered nurse health coach. Our nurses provide advice and direction on your most appropriate care. When you're not feeling well and you're not sure what is your next step, we always encourage people to start with a nurse. Talk to a nurse and make a decision on what your most appropriate care is. It may be going to see a doctor, it may not be. The wonderful thing about our nurse service is that when you pick up that phone and make the phone call, in about 30 seconds, you're going to get an answer. You can have English or Spanish instantly, and you can request translation in over 150 different other languages. Our nurses are going to help reduce the cost of care because they're going to give you better direction on what is your next step. 1 out of 3 times, our nurses will tell you to take care of yourself, so you just avoided that visit to a doctor altogether. 63% of the time, we find that the costs are reduced versus what our member was going to do initially. So our nurse helps guide you the right direction. Oftentimes we think we need more care than we actually need. Now, what if the nurse says, yes, it sounds to me like you need to see or talk to a doctor? Again, you've got a choice with our program. You can go see your doctor, or what we have available is consultations with a doctor by phone. Again, 24/7, wherever you are, whenever. It can be the middle of the night, you can be traveling, it could be a holiday. Our doctors are available for consultation by phone 24/7, licensed physicians in 50 states. Your consultation is $5, much, much lower than what you pay to go see a doctor. In fact, 80% of your everyday healthcare concerns can be taken care of by making a phone call to one of our doctors and having a consultation over the phone. The American Medical Association study showed that 4 out of 5 of your visits to a doctor can be handled just by making a phone call. Our doctors can write prescriptions. So, if doctor, when consulting with you, decides you need a prescription, he will forward the pharmacy you ask him to send it to. If you have a pharmacy you have a relationship with, you can tell them to send it there. We, however, encourage our members to use our Walmart Enhanced Care and Prescription Savings Plan because we know that our members will save money by going to Walmart and getting the prescriptions there instead. And it's simple. Just go in, hand in a form, and you will be registered and you will save on the cost of your prescriptions. On average, we see our members save probably around 23.5%. But we've also seen savings as high as 60%. So it absolutely is a benefit to go to Walmart for your prescriptions. So our Enhanced Care MD solution is a proven solution. We partner with established, successful organizations with solid reputations. We partner with Optum Health, a subsidiary of United Healthcare, which is one of the largest healthcare companies in our country. We partner with Walmart. We all know the Walmart name and we all respect Walmart. Our members have a 96% satisfaction rate and 92% reuse rate. So once you use our program, you realize how good it is and you go back and use it again. With our partners, we have over 2.5 million daily users. So we know that we have efficient service levels, proven, tested medical protocols, high scalability. Our program works. You get quality health care at a low price. In fact, we have a low family price for employees per month that is very attractive. For an employer, it generates favorable return on investment, goodwill for employees, as well as the intangible benefits. Happier employees, more productive employees. Employers can choose to share the costs with their employees. They can choose to pay for the whole program for their employees. And 5 Links Enhanced Care MD also addresses employee communication. So we connect with employees on a monthly basis to remind them of the program, to remind them to use the program, how to use it, why to use it, the benefits of the program. So we do awareness campaigns to keep it right in front of them, to remind them that this is a great way to save on your health care. Now, there's probably a few questions that we know come up all the time, so I'm going to turn it over to Tina and Dave, and they'll talk to you about those questions.
Thanks, Angie. There's been many questions coming through, and I picked out the top 3 that I felt were really important for everyone to hear the answers to and really just grasp. Because our businesses, the companies out there that you're going to be talking to, these are some of the questions they're going to ask. So Dave, one of the first questions I'm getting a lot of is Five Links Enhanced Care MD a qualified ACA insurance plan?
So the answer is no, because this is not health insurance. However, something to really take in consideration is that the Five Links Enhanced Care MD program will certainly help the ACA plans that are out there, because they're mainly high deductible plans with great out-of-pocket expenses for employees. So it's going to be really important for employees, for everybody, to have some means, a tool like Enhanced Care MD, that will reduce their out-of-pocket expenses while having a high deductible insurance plan. So it's important to let them know this is not health insurance, but it's certainly a solution that will help them with the Affordable Health Care Act.
So basically, the employer now has the opportunity to say, yes, I know that these plans I may be offering or may not be offering are, with high deductibles, but here's something for them
Absolutely.
to help offset the cost that their employees are going to be paying.
Exactly. I think this is a great fit for every plan that's out there, especially through the shop or through the individual exchanges. This is going to be really helpful. What other questions do they have?
Well, the second question is, I kept getting a lot of questions on deductibles. People are used to paying the $20 and $25 co-pays, and they're thinking that is their deductible.
Okay.
What is a high deductible insurance plan?
So that's a really great question, because I think because we're in it every day, we think everybody knows what high deductible insurance plan is. So we may say sometimes HDHP or high deductible plans. So what this really is, it's saying that you're getting health insurance at a lower premium, but you're going to have more responsibility for the deductible portion, meaning you're going to have more out-of-pocket expenses. As you mentioned, the $20 copay, you don't really know what that cost of that doctor visit was, because you just pay the $25 to $30. But with a high deductible plan, which is basically the Affordable Health Care Act options out there, and many companies are moving this direction regardless, and I think this has to be the way, that now the employee is accountable for those costs, those early expenses. And we're using some examples, but for a family could start as low as $3,000 that they first have to cover out of pocket before insurance actually kicks in, to as high as $55,000. And we've actually heard that there's higher plans out there for families that are much higher than that, but you're going to have a lower premium amount. So that's why the Enhanced Care MD program for commercial or residential is a great solution for many people, because this our plan, as we mentioned before, Jerry and Angie have said, this is going to help you reduce your out-of-pocket expenses.
Great. Well, the third question I get a lot is, who's going to pay for the service? So when our agents are out there and they're selling the service to companies, they're going to get asked these questions by the employer. Who's going to pay for it?
Well, that's a great question again, because there's so many options. The question really is, well, there's options. The company can choose to pay for it in total. We have customers right now that a company buys and pays for the entire benefit, because they don't offer health insurance and they want to offer something to their employees, or they want to offer this solution to help them gain confidence in using the system and being more aware of how to spend their healthcare expenses. So option one is really the company can fully fund it. But there's option two. A lot of companies have a shared portion. They currently say, hey, I want you to cover 50% of your healthcare premium now. So we encourage, it's up to the employer on how they want to do that. So they can pay for it full. They could do option two, which is take a percentage or a partial payment. And as Jerry mentioned about, if they cover at least 50% of the healthcare costs, they could be qualified for tax credit. So that might be a benefit. So if they cover 50%, maybe the employee should cover the other 50%, because honestly, that's a fair deal. And then, there's always the other option. When the companies say, well, I don't want to spend anything more than I have to, well, then at least allow the company to share it with their employees and have the people who do want to sign up. We just need to have at least 3 people to sign up for a commercial account. And if you can't do that, then sell them a residential. So that's what your options are from a payment standpoint. Those are good questions.
And even if the company, says that employee, we can't contribute, but the employee can choose the service. I mean, $30 a month
Yeah.
is nothing, because I'm pretty sure doctor's visits are anywhere from $140 to $178, depending on what you're seeing the doctor for.
Well,
So-
and just think of it, $30 a month is less than $1 a day towards a solution that provides you affordable healthcare or services. So it's something to really to consider. Another piece is that we mentioned, if they did do the employee option, they could do a payroll deduct. So employers could know that they could use their payroll companies to offer. There's a 125 cafeteria plan, which is an option they could use. So there's some other options out there.
Great.
So let me summarize also. One of the things that we did, Tina, we talked about when we first got together, talked about commercial. Remember, we said, let's make this registration process so easy for the employer as well as for the rep. We really didn't want this to be difficult for you guys to have to get really involved, but you wanted to make it simple for the employer to do it, because that's the stumbling block. Let's make it easy. So Tina, you had a great idea of how we could do this, and so this is what we created. So I'm going to summarize this all in a couple slides, but we created a page. So what you would do to how to get the first thing, how to get people enrolled in companies registered, is to send them through your 5 Links Enhanced Care MD commercial link and show them the website. We designed a website to help you sell the program, give education at the same time, but there's a buy now button or sign up now. And this gives you a register, how to fill out the first enrollment page that we need to start the business account. Okay. Also, just so you know, there is a one-time setup fee for commercial. It's a $49.95 fee to get started. You fill out the information, business information, a key contact person, and then the employer chooses the payment method, either a credit card or a reoccurring monthly bank draw, which is an ACH option that they have available. And when they complete that form, we automatically send them a welcome letter to that key contact person. So the employer, let's say, is the key contact person. They're going to get that email. We try to make it so simple that we've added a sample email inside that welcome email that we sent to the key contact person. So they just have to cut and paste, and they have a unique URL, a unique link that will allow their employees to self-enroll. So we've made it really simple for everybody. And then on day 7, we're going to give them a reminder, that key contact person, how many people have actually registered and signed up, so that you can compare it to the estimate that you thought you were going to do. Let's say you thought 5 people. And so it will tell you you've got 4, so you still have to get that one person to sign up. And then on the 10th day, if we have at least 3 employees signed up, we will charge the ACH or the credit card at that point, and the account will be live. And at that moment, that's when we send out the Get Started packets, the emails to the employees, and then that's when their reoccurring is going to start.
So basically, we've made it so simple for the employers to sign up.
Yeah.
They just fill out a form, and that's it. We take care of everything else.
Tina, you're so right.
We've made it impossible for them to say no.
That's right. So I'm hoping this is going to help everybody understand. And this is just a screen to show them what the employee has to do. And so the employer doesn't even have to track people down. Just say, fill out the link, and we don't have to do any special information for that other than just send out the link. And so it's really simple for people. And another piece that we talked about is that, everyone says, well, what if I want to change people, if I want to delete or add staff? We've given them the ability to go and do that themselves, the employer, but they can always default to our customer care group, and we can help them add employees and subtract. So we've really made it simple for everybody involved. So for 5 Links reps out there,
There are silent killers amongst us. Heart disease, stroke, cancer, all ready to take the lives of even the healthiest, young and old. It could be you or a loved one. Too often the severity of illnesses is discovered only too late. In a world as stressful as ours, you want to know that you have your health covered. You want to know your future is secure. Preventive Healthcare gives you the chance to seize a potential problem before it becomes one. early detection is crucial in preventing an illness from growing into an unmanageable problem, which in turn saves you time, money and your life. Since its inception in 2007, Preventive Healthcare has established itself as one of Malaysia's leaders in preventive healthcare services, offering comprehensive screening packages that cover every aspect of your health, catering to both the Malaysian public and customers from all over the world who choose Malaysia as the preferred health tourism destination in Asia. In exclusive collaboration with Pantai Hospital, Malaysia's premier hospital group, Preventive Healthcare offers you the best medical expertise in the region. The health screening programs are designed specifically for you with leading medical professionals. At the end of every medical screening, members will not be left with just a medical report, but will have medical specialists, nutritionists and diet professionals take them through the screening reports to ensure a clear understanding of the results. Through the Preventive Healthcare Customer Care Service, the booking and screening process, complete with post-screening services, is made easy and convenient. Appointments can be done online or via a phone call for any of the 9 Pantai Hospital branches throughout Malaysia. Prior to appointments, members receive reminders, and following screening appointments, Preventive Healthcare provides ongoing health education and awareness programs. Never before from any establishment, Preventive Healthcare provides the archiving services of your medical records for up to 15 years. Your medical records are securely accessible online or are just a phone call away. Let Preventive Healthcare be your partner on your journey towards a healthier life. Our collaborative partner Pantai Hospitals, founded in 1974, has grown to a group of hospitals. Pantai Hospitals has received numerous awards for recognition for upholding and maintaining the quality standards of healthcare. The strategic collaboration of Preventive Healthcare with Pantai Hospitals offers members access to the vast network of 9 hospitals throughout Malaysia. With over 500 consultants and facilities, Preventive Healthcare members have access to some of the best diagnostics available and immediate treatment if the need arises. At Preventive Healthcare, we understand the needs of the consumer and the ever-changing face of healthcare. Keeping a step ahead with your health can be easy, convenient and affordable. Live healthier, live smarter, live longer with Preventive Healthcare.